I wanted to share a quick update on a prescription drug case study I detailed about a month ago. And this one's really interesting. It's about an 1,100 life employer, multiple states, and we had gone out to bid in an effort to try to reduce the pharmacy spend. We negotiated some pretty significant savings in each year of the contract, about $750,000 in each year of the 3-year contract. We had some provisions in there on being able to monitor that the PBM was actually meeting their contractual guarantees. That resulted in about $237,000 in additional funds that the employer got. And over the first 2 years of the contract, we had gotten about $830,000 in prescription drug rebates, in additional rebates back to the client. So we had already negotiated really good prescription drug rebates, but we put a provision in place which basically allowed this employer to maximize their prescription drug rebates. They were earned in one of 3 ways. Each of the first 2 years, that resulted in an audit and additional rebates that were paid. First year was around $600,000, next year was around $230,000, but the 3rd year of the contract, we just got the results back, and this particular employer saw an additional $900,000 in rebates returned to them, and that was just for 1 year. So the story here is the same as we saw last time, which means there is a ton of opportunity right now for employers to go out and look at your data, go out to market, understand your different options that are out there in the PBM landscape, and make sure you're evaluating those options, because it could give you that competitive leverage you need to further reduce your costs. And we all need that in this world today where healthcare costs continue to rise and rise at an unbelievable pace. So again, I focus on pharmacy here because the slide says it all. It is the lowest hanging fruit on your prescription drug plan right now, or just, on your overall medical plan. Prescription drugs are the lowest hanging fruit. Go out and tackle this now, and you will start to see some money flowing back to your plan. So employers, if you're looking to take some action today, here's a couple things you can do right now to try to get a handle on this. So first thing I would do is take a look at your data. And if there's anything, it's the top 10 drugs by total paid amount. That right there is going to tell you where roughly half of your prescription drug spend is going. When you get that information, send it to your broker, and then go ask your broker to tell you how you can source those drugs at a lower price, whether that's sourcing it internationally. Maybe there's a biosimilar option of that drug available now, but go ask your broker to do that work for you. And the last step you should take is you should go out to bid on your pharmacy benefit manager. And you should absolutely look at some transparent, independent pharmacy benefit managers here. What I mean by independent is that they're not carrier owned. United Healthcare owns Optum Rx. You got CVS Caremark that owns Aetna, and Cigna owns ESI. That's about 80% of the market right there. You want to go to some pharmacy benefit managers outside of that, not carrier owned. Transparent means you understand how they get paid. You want a pharmacy benefit manager who will give you a client-ready contract right now to sign. You want all of that. So if you are trying to understand what's going on with your pharmacy spend, go get those top 10 drugs. Go make your broker do some work, and then go out to bid and keep your incumbent carriers honest.